Every year, the month of October is dedicated to shining a spotlight on ADHD or Attention Deficit Hyperactivity Disorder. As the theme of this year's ADHD month is Awareness is Key, let us take some time to understand what ADHD is, its causes, and what the symptoms look like. ADHD is a common disorder that affects millions of children, adolescents, and adults across the globe. ADHD can make everyday life challenging, especially when it comes to focusing, staying organized, and maintaining attention on tasks or activities. In simpler terms, it can make it hard for someone to concentrate or stay on track with daily tasks. Individuals diagnosed with ADHD typically show patterns of inattention, meaning they might often forget important tasks such as school or work assignments or feel disorganized in their day to day activities. These lapses can lead to incomplete tasks or unfinished projects. In some cases, individuals also show signs of hyperactivity and impulsivity, like fidgeting, which is when they make small movements with their hands or feet and find it hard to stay still. Many individuals may have symptoms of both inattention and hyperactivity together. Now you might be thinking, we all fidget or lose focus sometimes, right? That's true, but for a person to be diagnosed with ADHD, these symptoms must be persistent and they must show up in more than one setting, whether at home, school, or work, and have a significant impact on their life. It's important to understand that ADHD is not just about not being able to focus, being forgetful, or having too much energy. It's more complex than that. ADHD affects a person's ability to manage their thoughts, emotions, and behavior. In other words, it makes it harder for them to control how they act, think, or feel in certain situations. So, what exactly defines ADHD? According to the Diagnostic and Statistical Manual of Mental Disorders, the 5th edition or the DSM-5, ADHD is defined as a neurodevelopmental disorder characterized by a persistent pattern of inattention, hyperactivity, and impulsivity that interferes with a person's daily functioning and development. This means it causes long-term challenges in paying attention or controlling energy levels, which can disrupt daily life. The exact causes of ADHD are still being researched, but studies suggest that both genetics and the environment play a role. ADHD often runs in families, and studies show that it's more common among relatives of people who have it. Environmental factors like exposure to tobacco or alcohol during pregnancy may also increase the risk of developing ADHD, especially if there is a family history of the condition. Research shows that individuals with ADHD may have differences in the structure and development of their brains, particularly in areas that control attention and impulse regulation. There are three subtypes or presentations of ADHD in the DSM-5: inattentive type, hyperactive-impulsive type, and combined type. Each subtype presents its own set of 9 symptoms, and individuals can experience them differently. Children with inattentive ADHD often lose or forget things they need for tasks, like books or homework. They may seem like they are not paying attention when spoken to directly and struggle to stay focused on tasks or play activities. They may also find it hard to organize their activities and follow instructions, leaving tasks incomplete. This means they may start things but have trouble finishing them. They tend to get distracted by what's happening around them and can make careless mistakes because they have difficulty focusing on details. In adults, these challenges might look like difficulty focusing at work, forgetting appointments, or misplacing things like keys or documents. Their minds can easily wander to unrelated thoughts, making it hard to stay on task. Children with hyperactive, impulsive ADHD may fidget a lot, meaning they have difficulty staying still, or they may move around when it's not appropriate, such as getting up in the middle of class. They might talk excessively or interrupt others, find it hard to wait their turn in conversations or activities, and often blurt out answers before questions are finished. These behaviors can lead to trouble not because they don't care, but because they struggle to control their actions. In adults, hyperactivity might appear as feelings of restlessness where they constantly feel the need to keep busy. They may interrupt conversations frequently, often without realizing it, or having difficulty sitting down and focusing on activities for extended periods. Combined type ADHD is diagnosed when a person shows symptoms from both the inattentive and hyperactive impulsive categories. This means they face difficulties with both focusing and controlling impulsive or hyperactive behavior. For a diagnosis, the DSM-5 requires that children show at least 6 symptoms of either inattention, hyperactivity impulsivity, or both for at least 6 months. In adolescents and adults, 5 symptoms are required for a diagnosis. These symptoms must significantly affect daily life, such as at home, school, or work. ADHD is considered a developmental disorder, meaning the symptoms must have been present before the age of 12. Though ADHD usually starts in childhood, its effects often continue into adolescence and adulthood, indicating that these difficulties don't simply disappear as a person gets older. While some individuals may see a reduction in symptoms as they grow older, many will continue to experience ADHD related challenges throughout their lives. This means that ADHD often requires ongoing management. The symptoms of ADHD, such as trouble focusing, staying organized, and controlling impulses, can affect many aspects of life. It can impact school or work performance and even personal relationships. These symptoms are constant and disruptive, which can make it hard for individuals with ADHD to function smoothly in everyday life. There is no one-size-fits-all treatment for ADHD because the condition affects each person differently. Treatment usually involves a combination of medication and behavioral therapy. Stimulant medications are often prescribed to improve focus and attention, while non-stimulant medications or behavioral interventions may be better suited for younger children. Therapy helps both children and adults develop skills to manage ADHD. Children can learn to organize their time and stay on task, while adults may benefit from strategies that reduce distractions, improve organization, and enhance social interactions. Therapy can also help them learn how to cope with challenges in their daily lives. While ADHD presents significant challenges, with the right support and treatment, individuals with the condition can lead successful and fulfilling lives. They can perform well in school, excel in their careers, and lead happy lives. Early recognition of symptoms, an accurate diagnosis, and a personalized treatment plan are key to managing ADHD effectively.